Hello, all you lovely people. This is Dr. Huson. I'd like to just quickly show you our case of the month for this month. We had the most lovely gentleman come see us a while back. He had broken his teeth severely. You can see how the porcelain had broken off the bridges. He was grinding his teeth to pieces. He couldn't eat his food properly because they were just chipping and breaking. He lost teeth on the sides, and he just decided he'd had enough. So he looked up on the internet and he found Silver Oaks, looked up the reviews. That's him trying to chew the food, but the teeth had worn down so severely that it started causing jaw ache and all sorts. Besides that, he couldn't really chew his food, and he couldn't really smile because there just wasn't a good look. And you can see here how the teeth have chipped and broken. You can see how many teeth were lost because of just continual grinding and breaking away of the teeth. And because of that, the teeth were very flat and rounded off, which means you can't actually chew your food. I don't know if any of you have that problem. But it means the food, you can't actually grip it efficiently. You came to see us. We took some CBCT scans just to check what was happening, and you can see how all these teeth have been lost. In the 3D scan, you can see the big gaps that had formed because of the broken dentition. When he first came in to see us, we did a 3D scan of his mouth. And this is just some of the digital tools we use to create models, which we use then to design our implant stents, as well as designing the final outcome from the beginning. So we try and get the ideal outcome out of the photographs and the scans, which we place together on the digital smile design platform, and then we work backwards from there to try and restore and rebuild what was lost. So this is what we did. After taking out the bad teeth, we try to see what the new teeth could look like. So we make temporary models that just fit over the teeth, just to see where we need to correct and what we need to do, and this just gives us a guide as to where we are headed. We then proceeded with the implant surgery using digital guides that fit over the teeth. We do it one half first and the next half later, keeping the position of the teeth that we designed in the original plan. We clip these special 3D printed guides into place. Those are the temporary teeth. We just then place the implants through the guide exactly in the position we planned. That's the implant, that's what it looks like. It goes through the guide and it's placed in the correct position. So after the implants are placed, we put some temporary bridges. This is what the temporaries look like. So never ever had a gap, he never ever had dentures. He had a fixed bridge all the way through while he was waiting for the implants to the bone to go into the implants to integrate. It took about 3-4 months, plus some bone grafting, which took another 4-5 months. And so the procedure took quite a while, but in all the time he had these temporary teeth in place. And that's what it looks like when you attach the implants. You have these attachments that allow the bridge to be attached to the implants. And that's the final result after all the implants are placed and the bridges are fitted. You can see a very natural smile with lovely white teeth, correct positions. Big difference. Really happy patient, able to chew. All new teeth, fixed, and you can chew anything.